A warm welcome back. Thank you for staying with us on the AM show. On this first bit of the show, AM Talk, we're going to be focusing on the virus COVID-19 and some realities we're facing now. We're going to be talking about the vaccination effort, what it really means, how much is involved, and the real details of that. We're going to be talking about our numbers, but also we're going to be looking at a real life story, a survivor of COVID-19. Let me introduce now the guests who join us this morning on the show. Joe Jackson, he is a COVID survivor, and he also happens to be COO of Daylex Finance, and a man who is not afraid to share his thoughts on matters of national concern. That's why he joins us this morning to share his story. Mr. Joe Jackson, a very good morning to you.
Very good morning. It's good to be alive. It's wonderful.
It's a pleasure to have you.
Nothing wakes you up more than the fact that, this could have turned out a different story.
It could, and God has been good. And that's why I'm going to say, first off, thank God for your life. Thank God for your life.
So my mantra over these last few days has been God Day.
Yeah.
And today is a Vim Day. And life is good.
Life is good. Right. Also joining us, immunologist and research fellow at WACBIP, a man who, all the time we give him a lot of pressure. Hey, doc, let's talk. And he's always there for us. Today we kept you a bit. Dr. Yaw Bediako, thank you so much for joining us this morning.
Thank you, Benjamin. It's good to be here.
Great. So we're going to be discoursing on COVID-19 in the course of this bit, and you can actually reach out to us, share your thoughts with us on what we're going to be discussing on. The hashtag is AM Show. Let me start with you, Mr. Joe Jackson. Now, you have survived this, and I'd like to know, what were the symptoms, though, that you saw that made you come to the realization that you just might have COVID-19? Tell us your story.
Well, first of all, I've been considerably worried about COVID because of my obvious what the doctors call nicely comorbidities.
Right.
It hides a multitude of sins. I'm overweight. I'm diabetic. I've got high blood pressure. I've got a history of heart disease. So I've been concerned. And so I kept testing every now and then. Go and get a test. I got a test. A week later, the test came out negative. And a week later, I started feeling feverish, aches and pains. The old, what we used to call the malaria feeling. And it persisted and then it was accompanied by a dry cough. For me, that was the killer. There was a dry cough and something like a cold. So I went for another test 2 Thursdays ago, and boom, I tested positive. Now, so I tested positive, found out on Saturday. So on Saturday, I was asked to isolate at home. I must admit that my central COVID team called me, assigned me a doctor, did all the right things. I was really excited about their performance. And then I was home. The doctor came to see me on Monday evening. And after examining me, he said, I'm shipping you off to hospital. Your issues are a lot, and I don't like your numbers. And I don't like the way you're breathing. So I was shipped off to hospital. I was in hospital from Monday, Tuesday, Wednesday, till Friday evening, when they said, I'm not a doctor, so some of the numbers I really don't understand, but they said something like my some number came down dramatically, and I'm sure Dr. Yaw Bediako will be able to help, came down dramatically, and then they said, you can come home. So I'm home now, feeling very weak, surprisingly weak. I mean, I walk up the stairs and I couldn't even. I'm panting like I've been climbing the Kilimanjaro. But
wow,
I'm alive. And each day I feel a bit stronger. My numbers have been fairly stable. My blood pressure has been shooting all over the place, but feeling stable. Breathing is not a real issue. So, hey, listen, it's good. Life is good.
So how long has it been since you first discovered you had COVID-19? How long has it been, the process of recovery? How long has it been?
Okay, I first felt the symptoms on the 2nd of February. That's when I felt the symptoms on the 2nd of February, let's say overnight from the 1st, 2nd of February. I took the test on the 4th, and I found out I was, what do you call it? I was positive on Saturday the 6th. So I've been roughly close to 10 days since I took the test.
Right, and just to get to the specificity, because people have different symptoms when it comes to COVID-19. What have your own reactions been to the virus? I mean, some have respiratory illnesses, others have headaches. I mean, some have so many things put together. Have you experienced any of those, the respiratory bits? You've spoken about fatigue, which is one of them, but have you encountered any respiratory problems, and how have they been addressed?
Okay, okay, to put it in perspective, because you've heard some pretty horrible stories. I've had some respiratory problems, but they were not as severe. I didn't go on a ventilator or anything like that. At the hospital, I was put on a nebulizer 3-4 times a day. And at some time, I was given a little bit of oxygen. But apart from that, what they call the oxygen saturation levels held up pretty okay. So mine was really headache, a bad case of hiccups, fever, bodily aches, and general debilitation. And then, of course, my blood pressure was really chaotic. It was shooting up. One day it's 180 over 110, the next day something else, and then it comes down briefly, and then it just hops back up again. That was really where the doctors were concerned. My blood pressure was of real concern because of my heart, my size, and COVID. They say COVID will attack the weakest parts of your body, and wherever you show weakness, COVID is there.
Right. So I'll just engage you further on this, and with all apologies to Dr. Yao Bediako, I just want us to wrap up on a bit more. And Dr. Bediako, I would also have you share your reaction to the story and what we can, actually learn from all of this. But so far, can you share with us what your daily routine is as someone, recovering? What do you do? How do you take care of yourself, especially now that you're at home, to ensure that progress continues on this level of, recovery?
Well, first of all, I've still tested positive, and I have to protect the people in my household. Luckily, nobody else in my household tested positive, so I stay in my room. I'm actually speaking to you from my bedroom. I stay here. I don't leave. If it's time for meals, they put it outside the door, bang on the door, and go off. I have water brought to my room, and I'm isolating. I'm not stepping out. I've stayed here. Once a day, I clear the space, and then I go downstairs and walk in the sun very briefly because I'm feeling really tired and weak. But walk in, and then come back. So it's really continuation of the isolation. I will go for a test on Wednesday to see what whether I'm negative. If I'm negative, then I can get back into the land where things are a bit more normal. At the moment, I'm still isolating, and I think that's important to keep isolating, even though I'm back out of the hospital.
Right. I'm going to ask you a bit of a personal question. Throughout this period of discovery that you have COVID-19, recovery, and now where you find yourself, where you're just waiting to get to the point where you test again and find out whether you are negative, have you ever been scared, afraid of what could happen?
I have. I have. There was one day when I was struggling with my breathing in the hospital, and my chest was tight, and I was scared. I really got a bad panic attack, and it was a scary experience. It was a really, really scary experience, and I realized that there was something going wrong. What I did was, you won't believe it. It's a very strange way. I felt not like praying for myself, but I felt like praying for the person who was lying next to me. And I did pray for that gentleman, a lawyer who was lying next to me, and he was on oxygen. So somehow I felt, even though I was in distress, I felt I should pray for him. And after praying for him, you won't believe it, I fell off asleep.
Wow.
Woke up and my blood pressure had come down. But that was a scary moment. I can't tell you how scary that moment was. And the abiding lesson I have is that there is power in thinking about somebody else apart from yourself, even in your direst moments. But I have been scared. I'm telling you, this has been an experience that it shouldn't be. It's been a scary experience. But I know people who are dying. I have relatives who have been dead out of COVID. And I know my conditions. I'm realistic about the risk that I face. So it's been a scary part of this experience have been really scary.
Right. The very final bit before I go to Dr. Bediako, because I want him to react to this. Obesity. And interestingly, you shared on Twitter, your weight situation and how COVID-19 has actually brought you to the point where you realize that you must make some changes. The obesity situation in Ghana, when you look at the statistics, so high. We're even contending with child obesity now. And this has been a jolt to you, hasn't it? The bit about obesity and your need to exercise.
Listen, you see, to say it's a jolt is not. We know about obesity. You know you are overweight. You know you are at risk, but somehow you don't do enough about it. And it's if you're like me, you crack jokes about it, and it's all funny, and you think, oh, I can get by, and I'm okay, and if I do a little bit of exercise here and there, but exercise won't fix it. You've got to go on a diet. And if there's anything that it's clear to me, the bigger you are, the more troublesome it is. Let me tell you a story. Even to get a CT scan of my chest, the first my equipment was broken down at the Ima hospital. We went to another place. They said you are too big to get into a CT scan, so they couldn't get me a CT scan. I had to go to another place. At that point, I'd realized, it's the little things that hit you hard. And listen, you're so big, you can't get a CT scan. What on earth is wrong with you, Joe Jackson? You've got to fix this. And if you continue, you're just going to die. Dr. Bediako is smiling.
It's no laughing matter. It's no laughing matter, but reality here.
It's no laughing matter. And I'm on a crusade. I'm telling people, got to fix it. And it's not the walk once a day. You've got to fix the diet. It's the diet. I know it's the diet. I've just not done enough about it. Too lazy, too fancy, too everything to do something about it.
Joe Jackson there's, serving that word of caution. Watch out. Uncle Joe, I'll come for you one of these Saturdays. We'll go jogging, okay? Bit by bit, we'll do it. But let me come to Dr. Bediako now. Dr. Bediako, so maybe we could start off the conversation from your end with regard to some of those comorbidities or being overweight and other things that make people, put people at higher risk. And what's some of the things we ought to be looking at to prevent seeing the worst of COVID-19? Should we contract it?
Yes, thanks, Benjamin, and thanks, Joe, for your story. I think Joe's story is quite typical in many ways. COVID presents in many different ways. We've got different anecdotes on people who have suffered COVID, but I think the thing that runs through all of it is it's not a joke. It's not like just your typical cold that you can muscle through. If you do present with severe enough symptoms to require care, people go through quite an ordeal. And even from the very beginning, we were talking about comorbidities and the impact that would have. Unfortunately, in Ghana, a large number of people have undiagnosed comorbidities, so people don't even really understand their own risk. And that is really the challenge that COVID poses for us. So yes, I think it's. I was really happy to hear that Joe is still isolating. I think that's another thing that people don't realize. Even after you get out of the hospital, you have to make sure that if you haven't tested negative or you haven't been deemed to be no longer transmitting, that you need to protect your family members. Just because you've made it out doesn't mean that they might not be at risk. You have to continue to protect them. And then also continue to protect yourself, because there are several people in this country who have become reinfected. We have not new variants circulating that sometimes appear to be able to reinfect people who have had a previous variant. And I think, as Joe was saying, sometimes the long-term effects, we think of COVID as, I'm no longer on oxygen and I'm out of the hospital. But there are people, I believe Joe himself mentioned that he's dealing with fatigue. There are people who cannot walk up a flight of steps a month after they've recovered from COVID. COVID can leave significant challenges even after the virus is gone. The damage it has done, perhaps to your lungs and elsewhere, takes a long time to fix. And I think in this country, what we're going to have to follow carefully, given that we have such a large number of people who have been infected but were asymptomatic, these may present challenges that have not yet revealed themselves yet. So the idea that 10 years from now, we may be talking about people who have developed complications because they contracted COVID now but didn't even know it, but there was some damage done. So I think we're going to be dealing with COVID in one way or another for probably the next decade in certain ways, and all the more reason to do our best to minimize or to reduce the spread so that fewer people have to worry about what's going to happen to their health, well, in the short term and also in the long term.
You just mentioned that we're likely to deal with it at least for the next decade. That is not a comforting situation. Do you feel, so what should we be doing between now and, let's say, 2031? What are your expectations? That our healthcare infrastructure would be built up more in terms of dealing with a pandemic like this? What would your expectations be then within this period?
Yes, let me be careful to say, when I say we'll be dealing with it for 10 years, I'm not saying the virus itself will necessarily be here. I'm hopeful that within a year or two, with the use of the vaccine and effective vaccination, we will not have to worry about people getting COVID. But like I said, that we will need to carefully follow people like Joe who have survived COVID, and we need to carefully monitor them, because there is growing evidence in the US and the UK that COVID leaves lasting impressions on your body, and these are things that need to be taken into account. So, COVID being a COVID survivor will need to be considered as a risk factor for future health problems, and these people will have to get special attention. But you're right. I also believe that as a country, I hope that this pandemic will serve as a rallying call, or will serve as a wake-up call, that we need to enhance our capacity. We need to enhance our capacity to respond to threats like this. It is not just about building hospitals or primary healthcare facilities, but it's also about building the human capacity and the research capacity so that we can adapt. Just building a hospital is certainly needed, but we need more than hospitals. We need advanced laboratory capacity to do tests like have been required for COVID. We need them in many more places than they currently are. But then most importantly, we need to build up our research capacity so that we can almost predict to some extent when these outbreaks are coming. And when an outbreak occurs or a pandemic occurs, we are well placed to adapt, to develop our own solutions. And so ultimately are less dependent on other countries doing all the work and then us sort of benefiting. Right now, we are at the mercy of the countries that have developed the vaccine. it would be great if over the next 10 years we invest enough in research, so that if a pandemic like this did emerge again, you would hear that a vaccine developed in Ghana, or at least in partnership with Ghanaian scientists, was one of the vaccines being offered. At that point, you would expect that many more doses would already be available, because we would be producing one of these interventions. So I really think a lot of good can come out of this unfortunate situation, and hopefully in 10 years we'll look back and we'll see that 2020, 2021 were really turning points in our capacity building towards greater healthcare self-sufficiency.
You are at the very epicenter of the fight against COVID-19 based on the nature of your work. Looking at our COVID-19 numbers, and if I may, 8,216 active cases, 67,087 recoveries or those discharged. There are 533 deaths and 718 new cases. It appears the fight that is being taken to COVID-19, well, the virus is not necessarily responding. It is pushing back. Looking at our numbers, what are we getting wrong?
This is a very difficult disease to fight. This is a very difficult virus, and we're dealing with an even more difficult form of it at the moment, in that, compared to what we were dealing with last year, this variant is much more transmissible. And actually yesterday, news coming out of the UK suggests that this virus is actually more deadly. There's a reason why more people are getting sick. It's because this variant is more likely to cause severe disease. So we are in a significant battle, and the battle has gotten harder. We have ourselves to blame to some extent for part of it, because, in my opinion, we relaxed too soon and too early, and were very undisciplined in December, and we're really paying for that now. Of course, restrictions have tightened a bit since then, and I believe adherence, at least to mask wearing. When I drive around Accra, I've been seeing that more people are wearing masks than before. But I must say that I feel as though we almost put too much emphasis on masks and too little emphasis on social distancing. The real tool so if you think of the three protocols that are laid out, the hand washing, the mask wearing, and the social distancing, the only one that is, or the most effective tool, is actually the social distancing. Masks are meant to augment that, because we understand that it's impossible to completely socially distance. Joe is trapped in his room. For people who don't know their status, that is probably not something they can do, because they have to go to work, they have to go to school, they have to perform certain activities. So I think simply wearing a mask, excuse me, simply wearing a mask is not enough. If as much as possible, we should be avoiding crowding. And I still feel that is not really happening. It's almost as if if it's convenient to do so, then do so. But in general, at least wear a mask. And I think we need to communicate clearly to people that the social distancing, avoiding of crowding, it's incredibly important if we are to slow the spread.
Okay.
Mask wearing is useful, but we really need to try to find ways to minimize crowding. If you look at Accra right now, there's still plenty of crowding going on, which means mask, no mask, we're still going to have some transmission. Okay. Our positivity rates are still, getting close to 20%. We need to get it down to 5% before, we would say we are controlling the spread.
Let's talk vaccination, and the cost element is what I'm going to focus on here. And Mr. Joe Jackson, I would like you to pay attention here as well, because from the financial end, I would like you to give your take. We've been told that some African countries are ensuring that a vaccine shot, costs at less than $3. Others are pegging it at a little over $3. Here in Ghana, we saw a figure at some point, of about $10. In today's Daily Graphic, there is the figure of $3 there. Let's assume, Dr. Bediako, that we are looking at $10. What could be going into that? What could account for the very high price that we may, come to see in terms of the vaccination effort?
Well, I mean, these numbers are just, I guess, till the government releases its own numbers and we have verification. It's really difficult to put too much stock in whatever has been said. Certainly, other countries, the number I know, for instance, for AstraZeneca, the number that has been thrown around internationally is about $3 per dose, and that is, a fraction of the cost of, for instance, the Moderna vaccine, which is more like $30 per dose. So those are the numbers I have seen. I have seen the reports about different numbers being thrown around in Ghana. I think we have to be careful. These numbers, may be numbers, maybe the cost of the vaccine, so what it costs the government to procure the vaccine, but they also may be numbers that factor in the cost of vaccination. This is going to be an unusual and a highly labor-intensive vaccination program. It's going to involve deploying people across the country, and that will come at a cost. So it's possible that the cost per vaccinee or the cost per vaccine are including the cost of the vaccine that will have to be bought, as well as the manpower, the fuel, all the resources that are going to have to be mobilized by the government to roll out this vaccine across the country. So I think the new plan, the plan the government has released, I believe is a costed plan, and so we just wait for more details from them to understand exactly what it is costing the state. But whatever be the case, I have to say that this is something that Ghana has to do. So we have to find ways to bear that cost, because the cost of not vaccinating and not getting this pandemic under control will be significantly higher, I believe, than the cost of procuring and deploying the vaccine.
Right before I come to Joe Jackson, but just to confirm, would it be realistic if we were told that it would cost $10 per vaccine, not the entire logistics to do with vaccinating, but per vaccine? Would that be realistic? Would it be outrageous?
I mean, it would be surprising if we were paying $10 for a vaccine that's, for instance, other countries are paying $3 for. But once again, I think that is a question the government would have to answer. Procurement, anybody who's done any sort of procurement in healthcare understands that it is a very complex and typically driven by economies of scale. The whole reason why COVAX, the initiative that we are benefiting from for some of the vaccines, so actually the COVAX price, we're not going to pay for the COVAX vaccine. But COVAX is only going to give us 20%. So the government needs to find ways to buy more. The other method is going to be the AU task force, which has bought a large amount of vaccine, basically bringing African countries together to purchase a large amount and in that way negotiate for a lower price. So that is why I am not quite sure about the individual price Ghana will be getting, because at least two of the ways we are going to get vaccine are through this sort of group buying method, which would presumably be standardized across all the countries. So unless we are also, topping up by doing our own bilateral deals and then paying maybe a higher price, that I am not, they would need clarification on. But at least the two main mechanisms that I believe have so far been reported by which Ghana is going to acquire vaccines would be COVAX and then the AU task force, both of which I believe are relatively standardized across African countries, because they are meant to bring the purchasing power of each country together to increase our economies of scale and negotiate for better pricing.
Mr. Joe Jackson, on the same matter of cost, you're a finance person and you're interested in these matters. What do you think about the cost of the vaccines, what you've seen so far? And should it go as far as $10, as some suspect it could? What would be your take on the matter?
Well, first of all, my understanding is that the $10 was a budget. My second understanding is also that, like Dr. Bediako said, there are multiple ways we are buying this vaccine. And each of them some may come for close to free for the vaccine itself, and others may come at a cost. So really, in a lot of ways, we are looking at a blended cost. And a budget, a budget is a budget. Is $10, does $10 sound high to me? It does, but I'm not sure I know exactly what went into that budget. We must wait for a little bit more information before we throw out those numbers and we go against anybody. But here's the point I'm making. Regardless of the cost, if we don't buy the vaccines, the cost of this economy will be much, much higher than we can ever imagine. So we've got to get those vaccines, right? Otherwise, one, you don't have vaccines, your nation is going to be a pariah amongst other nations because your people are going to be infected. They're not even going to be able to move around the community of nations. Your economy is going to come down to a halt. Remember that COVID, if it keeps affecting us, is going to have a toll on the human resources of this country. And so we've got to realize that, in truth, being healthy is as economic as keeping the economy open. It's sometimes we talk as if there's a trade-off. There's no real trade-off. If we keep getting COVID, we're going to have to shut down the economy, or the economy will shut us down. So we've got to have those vaccines. And admittedly, $10 seems high, but hey, let's get those vaccines.
Let's get those vaccines. I would wrap up with you, Joe Jackson, on this bit. Now, you've been there, you've done that, you've had this experience. What would be your message to ordinary Ghanaians? What would be your word of caution to all of us?
Listen, number one, like I said, COVID is real. And I like what Dr. Yao-Bediako, I've been on the Mask Up Ghana campaign for weeks now. Even before I got that COVID, I was on the Mask Up campaign. And but what he said, which hit home hard, was this: we've got to social distance. We've got to social distance. There are too many little parties, big parties, outdoorings, weddings, family gatherings, meetings. All of us have got to find ways to reduce contact. And I think that is my abiding thing about how much risk you take each time you come into contact with somebody. You're taking a risk, and it's not worth it. I've been to the fire and back, and they say experience is what is left after the fire has burnt you. The fire has burnt me. I'm telling you, it's not a pleasant experience. Stay away. Stay away.
Thank you very much. Dr. Bediako, your final words, briefly.
No, I'd just like to echo what Joe has said, that this is a fight we are in. As citizens, we need to do our part in that fight. I think there's too much trying to find loopholes in the restrictions to continue to do what we want to do. Can I still have a wedding in a church because churches are allowed to meet? That is frustrating to me. The rules, His Excellency the President has no wish to prevent Ghanaians from getting married. But the reason that weddings have been banned is they've been recognized as super spreader events, similar with parties and other things. So please, as much as we promote mask wearing, let us find ways to minimize interactions. Let's find ways to minimize large gatherings or even medium-sized gatherings. And perhaps let's remove the wiggle room in our restrictions. But I believe that as citizens, we can decide to abide and to follow the spirit of the rule, not just try to find loopholes. So social distancing should be our mantra. If we do that, we will bring transmission down. Other countries have done it even without a vaccine. So we can bring it down. And if we bring it down, then we will protect more of our citizens. And the ultimate cost to the country will be much less.
Dr. Yao-Bediako is an immunologist and research fellow with WACBIP, and Mr. Joe Jackson is COO of Dalex Finance, a man who shares his thoughts on national issues. Gentlemen, thank you very much for joining us. Joe, thank you for sharing your story, and do have a lovely day.
Thank you.